Hi, my name is Dr. Paul Etchison, and I'm the owner of Nelson Ridge Family Dental. We're located in New Lenox, Illinois, which is a Chicago suburb. You can ask me a question. So when I graduated dental school, I took an associateship just to get experience, work on my speed and stuff like that. And it was a really good experience, but what was really lacking for me was I wanted to do things my way. I graduated undergraduate in advertising, and I learned a lot about branding and marketing and things like that. And I really, while we were focusing on clinical at this associateship, there wasn't much focus on patient experience or branding or just essentially like treatment acceptance via utilizing systems and training and making the patients feel good so that it was easy for them to say yes to treatment. So that was my vision going into it, and I tried working with teams, team members at the associateship, but it was well apparent for me right away that I had to be an owner. So I did a startup, and we opened our doors with just me and three other people, and we grew very large and grew very fast. A lot of it due to just our vision and what we really believed and how we conveyed that to our patients. And we just had a great brand, and it just kind of took off, and we ran with it. And so as far as becoming an owner, it was something I always wanted to do. I always knew I wanted to do it. It just was a question of when. So it was about 2.5 years after dental school, and I took the plunge to start up. So I had thought about taking on a partner after the coronavirus shutdown, and being shut down, being at home for 11 weeks kind of just led to just a lot of soul searching and just like looking at the amount of stress in my life. And now before we were shut down, I would tell you that I delegated almost everything in my office. I wasn't taking a lot of admin burden. I wasn't very stressed out. But then once it went away, when the shutdown, I started to realize that it was a very stressful thing, and I had a lot of responsibilities. So when we came back, I said I was just going to do a lot of things differently. I didn't want to have that stress again. And the more I spent time, we had all these changes, and when we came back and I'm establishing boundaries and I'm deciding I'm going to do things differently, I realized that I just had a lot of responsibilities. And it was the moment that my practice had 34 employees, it was just time for me to bring on a partner. I just needed help. I just couldn't do that responsibility all myself. So when I was looking at different groups and different partnership organizations, I had talked to maybe 3 or 4, and what had really drawn me to MB2 was that they felt very different. The culture felt different. It was more about doctor autonomy. It was more like I was still an owner. I still had autonomy. I could still make decisions in my practice, because in my opinion, I just don't think I would work well with a group that was going to tell me what I needed to do all the time. So that was very different to the other 2 groups that I was talking to. So when I got to learn more and more about MB2 and their culture and meet the people that work there and talk to some other doctors that have already partnered up, it was just very apparent that this was the right stage, the right next step for me. And I've had people ask, like, oh, were you burnt out? Like, do you not love doing dentistry anymore? And that wasn't the case at all. It was more just I was ready for a new adventure, and the feeling of having somebody have my back, have someone that's on my team that can provide these services and all the discounts and all the benefits that come from being with a group. So I can't say that any of the other groups I talked to would have been a good fit for me. I think they would have been good as like if I was maybe trying to exit and I didn't want to be a dentist anymore. But I think MB2 is a great fit just for sake of that. I think it's going to be a really good partnership, and it's going to work well with the way I want to run my office, which is what's most important to me is the way that we treat our patients, the way that I treat my team, and that my team is happy, and this is a fun, great place to work for us as well as for our patients to come to. So outside of work, I mean, I have a lot of hobbies, like as much as like I don't see clinical patients as much as most dentists do, and a lot of my friends are like, dude, like, what do you do all day? And I have tons of things I do. I mean, I golf, I like to shoot guns, I like to hang out with my friends, have a really large peer group. We get together a lot. We used to go to bars all the time. We don't do that anymore, but that'll come back soon. And I have like side things. I have my podcast. I've written 2 books. I like creating content for dentists, like training videos. So there's a lot that I like to do. Lately, like ever since partnering, I've been spending a whole lot more time with my kids and my wife, and that's been good. And it's been nice to go home and kind of, I wouldn't say it ever 100% shuts off being an owner of a business, but it's definitely a lot easier to shut it off knowing that I have the support services that I do now partnering with MB2.